Welcome back to another stakeholder engagement video. Hope you found the previous video useful. So this video is about a qualitative evidence synthesis on young people and online eating disorder content. The review was conducted by NIHR Policy Research Program Review Facility, and the review team was members of Epicenter staff, UCL Social Research Institute, University College London. The review question was, what are young people's views and experiences of online eating disorder content, and what influence does it have on their relationships with their bodies, weight control behaviors, and or any other eating disorder symptoms? So they have defined online eating disorder content is as material or exchanges identified by young people as holding potential to influence their own or others' distress or concern about body image or about behaviors related to body size, shape, or weight. Let us see who are the stakeholders consulted in this review. So two main group of stakeholders, a group of young people with lived experience of online eating disorder content, and a stakeholder advisory group. So let us see what was the purpose of stakeholder consultation in this review. The main purpose was to ensure that the review explored areas of relevance to young people. So the role of scientific advisory group. So it was a multidisciplinary advisory panel. It was set up to inform and guide the review. It consists of professionals or experts specialized in child and adult eating disorders. So the group had met once. So at the initial stage they had met when the emerging findings about the nature and quantity of research evidence identified by a systematic map to support the scope and shape of this systematic review. So the review team had undertaken a systematic map earlier to identify the nature and quantity of research evidence on this topic, and the scientific advisory panel was consulted to shape the scope and to conceptualize the key concepts of this systematic review. So how the stakeholder consultation was done? The consultation with young people was conducted as two online workshops. So workshop 1 was held when coding work had started to identify the extent and nature of existing research studies, and workshop 2 was held at a later stage when findings were started to emerge from the qualitative synthesis. So it was an informal and open-ended but was structured around the following questions. So workshop 1 had the following questions like what are the different types of online eating disorder content that the young people might engage with? What matters most to young people about online eating disorder content? What terms or language might young people use when discussing this topic online? So this was the focus questions for workshop number 1, and workshop number 2 was to discuss the emerging findings. So the discussion was around like to find out like what is important for the young people, what is more important, what is less important, whether they're surprised by the emerging findings from the research literature or they find anything missing from the literature. So the format was an online workshop. Interactive whiteboard was used to encourage the anonymous posting and analysis of ideas. Participants were also encouraged to use the meetings software chat function and their microphones. So the main aspect is, let us see if involvement of stakeholders, how it benefited the systematic review. So we have seen the advisory panel was met once in the initial stage to conceptualize the review, and the discussion covered the following topics on prevalence and risk factors, and they also were experts in this topic, and they also mentioned about the increase in referrals to health services, especially during the COVID-19 pandemic time. Different population groups with different risk, and also they have provided valuable inputs on pathways in conceptual framework, and they recognize gender as a major risk factors And also advisory panel provided their advice and expert opinions on young people's experiences, types of OEDC content to be explored, and the intervention strategies. So let us see the details of consultation workshop with young people. So the first workshop was based on 3 questions, and they have provided detailed response for each of the main questions, like different types of OEDC content they find that young people might engage with, and what matters most to young people, and what terms or languages might young people use when discussing this topic. You can see the details in this report. I have provided the reference, and the report is available online. So I'm not going into the details of the young people response of the first workshop consultation. I would like to provide more details on the second workshop consultation. This was conducted when the emerging findings of the qualitative synthesis, that stage of emerging findings. So the young people identified several issues as important ones that the research team should explore further by examining the studies under review, including demographic research gaps. So the young people suggested that it is useful to look at what kind of young people have been included in studies of OEDC, whether any groups were underrepresented or overrepresented in terms of ethnicity, gender, or age. And also they have the young people were interested in looking at eating disorder research gaps, like what kind of eating disorder and related content are most addressed by the studies and what is less addressed. And they also highlighted that it is important to look at specifically on the more recent social media development, for example, TikTok, young people who are not posting but who are a kind of silent consumer of OEDC, young people frustration with OEDC and their views on the potential for it to be damaging, young people's use of OEDC for self-validation, promotional forms of OEDC, sites that present themselves as focused on OEDC, on eating disorder recovery, experiences that lead to the seeking of OEDC. So the stakeholder consultation was useful to get the ideas and opinions of young people, and especially what they considered are more relevant, more important, more useful to them. So this helped the review team to shape the qualitative findings based on what is relevant to the young people. So there are several take-home messages from this example. You can take the messages when you conduct systematic review and plan to involve stakeholders. So some of the key points are: it is very important to identify who are the stakeholders and what is the purpose of involving them, at what stage you would like to involve them in your review. And if you are involving them at a particular stage, you need to structure it, like what are the questions to be asked, how many consultation process you would like to have in your review, and all the like logistic and the technicalities of the stakeholder consultation workshops, or if it is a whether it is an online or the face-to-face workshop, and what discussion you would like to have during the meetings. And one of the main important aspect is like the documentation. See, in this particular example, the review team had documented all their experiences with stakeholder consultation, the detailed responses you can see in the report. So we need to document these things in our systematic review, which I think it is not happening in most of the published systematic review. They may be having stakeholder consultation, but not much information available in most of the published systematic reviews. I can understand that there is a limitation of words, like the journals will have a limitation of 5,000 words or 7,500 maximum, sometimes even 10,000 some journals. But it is, I know it is difficult to document all these things and publish when we publish a systematic review. So it is important that we can, that this type of information can be provided as an appendix or an online supplementary material, but it is very important to document this so that the readers or the users of this systematic review will be able to understand and gauge the importance of stakeholder consultation and what specific input was provided by the stakeholders. So thank you very much. Please like, share and subscribe, and see you soon with the next video. Thank you.